discovering new drugs for longer life, surprising candidates like Viagra. Imagine this. In a few months, 240 mice will be eating food sprinkled with Viagra. Yes, the same drug that's famous for treating erectile dysfunction. But these mice don't need help in that department. They're part of a unique study looking for drugs that might help them live longer. Alongside Viagra, another group of mice will be fed captopril, a drug used to treat high blood pressure. Neither of these drugs are new, but scientists are curious if they might also hold the key to extending life, not just for mice, but eventually for people like you and me. This research is part of a 22-year project run by the National Institute on Aging, NIA. It's called the Interventions Testing Program, ITP, and it's all about finding compounds like drugs, supplements, or even hormones that could make us live longer, healthier lives. Over the years, the ITP has tested more than 60 different things. You've probably heard of some, like fish oil or turmeric, curcumin. Viagra and captopril are just the latest additions to the list. The program is so important that the NIA recently committed over $5 million a year for another 5 years to keep it going. Why is this research important? The ITP has become a gold standard in aging research because of its transparency and careful testing. What does that mean? Well, every single compound is tested in the same way, across 3 different labs. The scientists make sure the mice live under identical conditions, so results are reliable and not just a fluke. This kind of careful repetition is rare, but it's exactly what makes the results so trustworthy. Experts say the ITP has helped identify some drugs that could extend life. But maybe even more importantly, it has debunked a lot of the hype around so-called miracle cures. Ever heard people rave about resveratrol, the compound found in red wine? ITP tested it 3 times and it didn't help the mice live any longer. The same goes for fish oil, Meto-Q, and L-leucine, a popular supplement. So, it turns out, not everything that's hyped actually works. Success stories, rapamycin, and more. That said, the ITP has also made some really exciting discoveries. One big one is rapamycin, a drug usually used to help organ transplant patients. The surprising thing is that when older mice were given rapamycin, their lives were extended, even though the drug is known to suppress the immune system. And it's not just in mice. Some studies suggest that rapamycin might even help humans. For example, one study found that it boosted elderly patients' responses to the flu vaccine, which could be a big deal for older people's health. Right now, more research is being done to see if it can help with things like Alzheimer's, muscle weakness, and gum disease. Other unexpected findings: drugs like canagliflozin, usually used for diabetes, and 17-alpha-estradiol, a form of estrogen, also showed promise in extending the life of mice. The hope is that one day, one of these could be the key to slowing down aging in humans. Aging is malleable. What does that mean? In simple terms, the ITP's findings show that aging isn't just something we have to accept. It can be slowed down. Of course, turning these discoveries into treatments for people isn't easy. For starters, the US Food and Drug Administration, FDA, doesn't consider aging a disease, which makes it tricky to get approval for anti-aging drugs. But scientists are hopeful. One exciting trial, led by a researcher named Nir Barzilai, aims to test a diabetes drug called metformin to see if it can slow down age-related diseases like cancer and dementia. The future. Where do we go from here? Scientists are now looking for new ways to speed up the research. One idea is to measure certain aging indicators in mice, like levels of specific hormones or immune cells in their fat. If these indicators change when the mice are given a drug, researchers could then look for similar changes in humans. This could help pinpoint which compounds are worth testing in clinical trials, saving both time and money. While the search for the ultimate anti-aging drug continues, scientists involved in the ITP believe the future looks promising. Each year, more and more new compounds are being tested, proving that there's still a lot of curiosity and excitement in the field. So, while we're not quite at the point where we can take a pill and slow down aging, the fact that scientists have already found a few promising compounds, like rapamycin, shows that it's not impossible. And who knows, maybe one day, a drug like Viagra will do more than we ever imagined.